Okay, so I'm going to talk a little bit about the patient-specific simulations in FEniCS that we are trying to do. This is joint work with Susanne, Anders, Oddrun, Christian from Simla, and also some neurosurgeons from Tromsø, Tor and Jørgen, and Jingfeng Zhang, who's in the med physics in Wisconsin, and Charles Trotter, who is a radiologist. So what we are studying is blood flow on its way up to the brain. So you have two arteries on the front of your neck and two on the back. They connect in this circle called the circle of Willis. Exactly why we have this circle, there are some theories about that, but anyway, we have this circle, and unfortunately there are a lot of troubles with this circle because it's a peculiar construct. So roughly 1 to 6% of us will develop aneurysms there. So these aneurysms are balloon-like structures sitting on these vessels, and they may rupture, and then you will have a stroke. And the stroke you will get then is the type of the most deadly kind of stroke that you can have. So about 30% will die within the first 30 hours or something like that. So a lot of us will get this. The risk of rupture is very low. It's estimated to typically below 1% per year. And this is a dilemma for the surgeons because they see this a lot, but they don't know how to or which of the persons that they should perform surgery on. They only have rough indicators, like if a person smokes, then maybe you have 10% more chance of getting a stroke than if you don't smoke. And it's really hard to use indicators like that in practice on individual cases. So this is the kind of problem that our collaborators suggested for us a few years ago. And the basic reasoning that they have is that there are a lot of variations in this circle. Some vessels are missing, some vessels are small, etc. So they have, by themselves, started to think about maybe it is the geometry of the circle that is important. And of course, we think then that these variations, they will set up a different flow pattern in each of the circles that will lead to a different stress acting on the vessel wall. So from our perspective, this hypothesis that the surgeons have come up with, it sounds perfectly reasonable to try to attack this problem from our point of view. And of course this is a textbook version of the circle. This is a real circle, and this is a nice circle. It's actually my circle, so but it is fairly well balanced, according to them. But I don't know if they. Okay. So. At the same time that they were kind of measuring my head, they also asked me to have a look at a few aneurysms. Like you have this one, a fairly large aneurysm sitting there, and you have another aneurysm sitting here on another vessel, and they wonder which of these aneurysms are the most likely to rupture. They have to deal with this. These were the people that came in that day that I was there. So, and they have to wave their hand and find out which of these they should do something with. So there are some basic experiments that has been done that suggest that the stress on the vessel wall changes the vessel wall. For instance, you have experiments by Chen, who has basically put cells on the bottom of this backward-facing step problem and just let a nutritious fluid flow past that. And then you see that the cells are like this in the beginning, and where you have disturbed flow, it continues to be like this, while here it changes. So evidently the vessel or the cells, they are rearranging themselves according to the flow in this experiment. So this is kind of the reason that we are trying to look at fluid flow and use risk indicators as shear stress, low, high, oscillatory shear stress, and pressure to kind of whether these are good indicators that can be used in practice to actually answer their questions about which of the aneurysms that are dangerous. So this is another case that they have faced us with starting about a year ago. This was a patient that they got in for, that came in. She had trouble speaking, etc. So they saw that the blood supply to the brain was too little. So they had to do something about it. This person does not have a complete circle because these vessels are missing. Furthermore, one of the carotid artery is blocked by plaque, so that's also a common disease. So basically this one artery is supplying blood through both the left and the right parts of the brain, and she gets too little of it. In addition to that, she has an aneurysm there, so they don't dare to do anything about this aneurysm since the blood has to flow here, through there, and to this side of the brain. What they wanted us to look at was whether a bypass would be beneficial. So you simply take a vessel from here and you connect it to the circular villus. That's what they suggested to do. So what do we use to try to answer this question? Well, we have used FEniCS, which is a tool made by Luca Antiga in Italy. And by using this tool, you can go from medical images like this, create images like this. We have added a couple of things to FEniCS. So now you can steer the resolution. You can create FSI meshes. You can also have various material types inside the mesh, so that you can, for instance, play around with coiling, etc. So we have added some nice stuff here.